going through any sort of diagnosis is really, really difficult, and it shifts the sand from underneath people. At first, you don't have to be very empathetic to understand how distressing, possibly being called in the middle of the night and asked to go into A&E or to come into a haematology office the very next day with a high white cell count and everybody's fight and flight responses are firing. And then there's a period of waiting while we work out what the diagnosis is and confirm it. And lots of people have to go through often quite distressing procedures like a bone marrow biopsy. And there's a lot of very acute feelings around a diagnosis like that. And then eventually you meet a haematologist, and I would say 50% of the time they're smiling and they're desperate to tell you that it will all be all right and you'll just take a tablet every day of your life and you'll live a normal life expectancy. And for a lot of people that's the case, but for a lot of people that isn't the case, and they have a very anxious period where they're not the person that's true for. That drug isn't quite the one for them. They're not quite meeting their milestones. And so what's initially a really, really acute situation can then turn into, a very upsetting and unsettling 6 months or even year of their life, while we find a kind of equilibrium between a medication that's working for people, but they're able to tolerate. And obviously for a few people, that can result in needing to proceed to transplantation. So in my experience, I wouldn't think that adrenaline of the initial diagnosis for a lot of people sort of settles for many months, even potentially for the first year. And these drugs are all drugs that people can live on lifelong, but a lot of them will have side effects. And a lot of those side effects will be particularly acute in the first few months. And we forget, I think, on our side of the hospital table, that people are learning a new language. Me, like many people, finished biology at age 15. We labelled a daffodil and we moved on. And if we were in Who Wants to Be a Millionaire and asked whether your blood is made in your thymus or your liver or your spleen or your bone marrow, I'm not sure many of us would go home with the money. We're learning a new language, we're learning new concepts, meeting new people when we're in new environments. And there's a lot to take on for people. And that can be, very upsetting and very unsettling. But it does give people, in a way, a permission to keep their life in limbo for a short period. And understandably, they are the focus of their family and their friends while they go through that. And rightly so. They know that they'd probably be there for their family and friends in a similar position. But what we talk about less is what happens when the dust settles, when people have to return to normal life, but they don't feel normal anymore themselves. The assumption that your body is going to work and support you in what you do is gone, just like if your car starts going on the blink and you're never sure in the morning whether you're going to turn the ignition and it will start. And people start shifting the weight of what's important to them and have to sort of, throw all the balls up in the air and wait to see where they fall and how they settle. And this sort of initial stress and moving into a period where you're now somebody who's living with chronic disease, you're meeting people, perhaps new colleagues, new jobs, new friends. And at some point, you may or may not decide, am I going to tell them that I've got CML? Am I going to tell them I'm someone who's living with a chronic leukemia? Maybe you meet someone on Match.com. Are you going to tell them, I'm not sure I'll be able to have kids very easily because I take a tablet every day? Or at some point, you're going to need to sort of tell them. And that's really difficult for people to say, I'm a bit different. My life's a bit different to yours. I might not be quite the person you thought I was because I'm carrying something else. And that can be really hard for people. And it's often what I end up talking to patients about, and the trust that they need to put in other people to share that with them. So I think for a lot of people, it can also result in what would have seemed normal before now feeling slightly dangerous. So a lot of, you have the odd rash, you shrug it off, you've got a little bit of a sort of weird spot on your leg, let's see what happens, it'll probably go away. You've got a funny feeling in your back, I probably strained it when gardening. for a lot of people, when they're living with a chronic illness, having gone through that really acute situation, that can now feel threatening. People can feel a little bit hypervigilant, and the way they would have approached different situations and health situations can now feel a lot more dangerous. And also people will go through other things in their lives, won't they? They'll also, need a knee replacement, or, their thyroid was acting up, and the additional strain of having to make sure all your healthcare professionals communicate with each other. There's a lot of things to think about when you live with a chronic illness. Getting health insurance, life insurance, all of those things as an extra layer of complexity and difficulty. But at some point, people have to move on with this process of adjustment and accepting this. And I don't know about your experience, but I've seen lots and lots of different approaches. I've seen some people who, become the trustees of charities, do fun runs, run Facebook groups, coffee mornings. I've seen some people who will admit that they doom scroll late into the night, or bring in printed out complicated pieces of research done by Japanese doctors sometime in the 1990s and ask me to interpret them. And some people just don't want to talk about it and don't want to know. My experience tells me most people do a bit of all three at some point, and that can vary over time. But what we want, what people really want from life, is that is not their primary focus, that they are, a teacher or work in a garden centre and they like badminton, or, they're really into chess, or they just like watching stuff on Netflix. And that is their primary life. And CML is just something that's there in the background, and it's not what they would have chosen, and it doesn't not have an effect, but it's just okay. So how do we help people to move from these scenarios? And I'm sure a lot of people will recognise a lot of the things I've said, to being there where it's just okay. I think difficulty is learning to self-manage is really important in that. Nobody expects you to get a medical degree and understand it at a super, super deep level, but having some understanding of your disease, some understanding how the drugs work, some understanding of side effects is really helpful to buy back a little bit of control, as well as being on top of adherence. I mean, we know in almost all diseases across medicine, CML is not the exception. Not taking your tablets is more common than taking your tablets. But just having just a foolproof little system where you're not halfway down the road, did I take it? Did I not take it? I'm not sure. Should we turn back? Where you don't have those little stressful upsets. You just know that you have, and you're planned, and you're sort of unchaotic about it, and that can buy back a lot of control as well. All of this is an ongoing process, and it's going to be very, very different for different people, because we don't arrive behind the table having a diagnosis broken to us as sort of tabula rasa, as blank people that this is a new experience for. And people's experience of illness is informed by all sorts of things. Forefront in most people's minds at that point is the medical factors. How aggressive is this disease? What's my prognosis? Is this going to be very hard for me? What's the burden of the drugs going to be like? But that will be different to you if depending on the social factors in your life, what your finances are, your family, your interpersonal relationships, how your work is treating you, lots and lots of different factors. How far you live away from the hospital is one. Does this involve expensive journeys to come to see us? And then there will be the psychological factors. How we've all arrived at a diagnosis with our life experiences. How we react to threat is always different. Pre-existing mental health challenges, traumas, life histories that we've had, our coping styles, they're all really, really different. And what I say to patients is, family and friends will do what they should do. They'll tell you, we love you, we're here for you, I'm going to run a marathon for CML support, I'm on your side. And you may not want to burden them, or maybe sometimes you'll really need to have a good cry and a hug, and that's their role. I know that Dr. Ali and me, we want to be holistic practitioners. we want to make sure that people are all right, but time has always got a few constraints in a hospital setting, and we are focused on the objective points. We want you to be well, but we can't always provide the level of skill and an understanding that a trained psychologist or counsellor might be able to. I'm very lucky in my centre, and I completely acknowledge that that availability of counselling and psychologists really varies across the country. But talk to your team, talk to your GP, because having that third space that you can go to where you can take all that dark feelings, sometimes illogical feelings, and bring it to a safe place with a professional who understands what you're going through and can support you is really, really important, because we need to have these honest conversations. We need to acknowledge the stress that can be caused by a physical health condition, and we need to accept that our experiences are valid so that we can move on with life, and let CML be something we're living with, but that's just okay.